In central China, a man has died following an outbreak of an unknown pneumonia-like virus, which officials say comes from the same family as the deadly SARS virus. Health authorities say that only
new cases and deaths associated with the coronavirus continue to climb right around the world.
The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy.
That almost 60,000 people have died of COVID-19 in Chinese hospitals in
mysterious pneumonia outbreak in Wuhan, China.
A new type of coronavirus.
The number of affected countries has tripled.
The World Health Organization has just declared that this is a pandemic.
In December 2019, the world woke up to the news of a new virus that had been detected in China. While not much was known about it, two things became very apparent from the onset. The virus was deadly, and the virus had no cure. As doctors and researchers scrambled to understand it, soon the virus had a name: the novel coronavirus disease of 2019, or COVID-19 in short. The more we learnt about it, the more we discovered that it was highly transmittable, spreading like fire across the globe. The unprecedented scale of infections would cause the World Health Organization to declare it a global pandemic. In early 2020, the private sector, citizens, and international community invested significantly in assisting the government of Zimbabwe in managing the pandemic. On a weekly basis, various stakeholders were handing over donations in cash and kind to the government of Zimbabwe to assist in prevention and mitigation measures.
The pandemic has reached our region, and we now have to escalate our national response.
The government of Zimbabwe instituted a number of measures to combat and contain the pandemic and reduce its negative impact, especially on the poor and vulnerable members of society, many of whom had lost their source of livelihood.
Today, government deliberated on this looming threat and has decided to take additional measures to ensure that our national response is effective, comprehensive, and complete.
COVID-19 not only created public health and social and economic crises, it exacerbated challenges in public spending worldwide. In particular, it showed how corruption can compromise processes. As history will now show, if left unchecked, public emergencies provide opportunities for corruption. TIZ initiated advocacy and research on the issue of abuse of resources for public emergencies, anchored on lessons learned from effects to combat corruption during previous disaster responses. Using the case study of the cholera epidemic 2018, Cyclone Idai 2019, and the COVID-19 pandemic, TIZ has noticed irresponsible usage of public resources, an issue which is reflected in public audit reports on these emergencies. The large sums of money required to deal with emergencies and the need for urgency in disbursing these funds forms a perfect storm for corruption. The COVID-19 pandemic exposed a lot of opportunities for corruption and maladministration of public resources. Furthermore, the pandemic came during a time when there was a huge public outcry against high levels of corruption in Zimbabwe. The 2020 Corruption Perception Index report by Transparency International highlights the following key findings on the use and management of COVID-19 resources globally. COVID-19 is not just a health and economic crisis, but a corruption crisis as well, with countless lives lost due to the harmful effects of corruption, which undermined a fair and equitable global response. In a well-documented case, the then Minister of Health, Obadiah Moyo, was charged with criminal abuse of office over the alleged awarding of a multi-million-dollar contract to Drax International for COVID-19 supplies, an incident which resulted in him being relinquished of his post as minister. He was later acquitted and his case dismissed.
I want to emphasize that by the time this matter was raised on social media, we as government of Zimbabwe, we were already taking corrective action. But coming back to your question, there is no financial loss to Zimbabwe on that contract. No, none at all. There's no financial loss. On the basis of the information that has been translated to us because of the nature of how the contract was designed.
Given these complex changes emerging in the management of COVID-19 resources, there was a need to ensure that citizens are mobilized to track and understand these dynamics. Transparency International Zimbabwe invested its efforts in firstly identifying the potential corruption risks associated with emergencies and secondly, calling for improved access to information on the distribution of COVID-19 vaccines.
Now, what we noted as an organization is that there was an information gap in the detail as to who won the bids, the amount of money they were going to get. Basically, there was an information gap on the winning bidders for supplying government with materials for COVID-19. And that's where we intervened as an organization. We approached the authorities to try and figure out what was being done around the procurement of COVID-19 goods and services. There was a trickle of information coming from various government departments. You were not getting a full picture regarding the bids, the winning bids. And so in March 2020, we wrote to the Ministry of Health and Child Care trying to get detailed information on the winning bidders and just to, in the public interest, release information on the procurement of COVID-19 materials. We did not get a response, so that we had to approach the courts to get this data. And this was granted in September of 2020. The court, High Court, basically granted us the order to receive this data from the Ministry of Health and Child Care.
TIZ used information from the court order to launch an online COVID-19 tracker summarizing donations received, procurement of goods and service, and details on receipts and distribution. TIZ continues to liaise with the authorities to get new data to ensure that this tool is as close to accurate and consolidated as possible.
One of the key findings from our COVID-19 resource tracking was that there is a dearth of information, and that government is not government was not willingly providing information, making the tracking system very difficult until prompted. We thought around how do we ensure citizen oversight on public resources? How can we be the public eye for the public resources during such an era, such an emergency situation? We knew there was procurement happening during the period, procuring of PPEs, procuring of vaccines, all that happening. But the big question remained, who is managing the public pace during such a scenario? So it is important for civil society organizations, as one of our key lessons, to be very vigilant during such emergent situations. There is need for vigilance on the part of civil society organizations, on the part of individual citizens, the media as well. You find that key journalists and media outlets, they were very influential for exposing some of the rot corruption cases that emerged during the height of COVID-19 pandemic.
Elected members of parliament, watchdogs, and civil society organizations play an important role in enhancing transparency and good governance on issues surrounding public procurement. In 2021, the Office of the Auditor General published a report which highlighted several irregularities in the disbursement of COVID-19 relief funds.
The special report on COVID-19 resources it exposes the loopholes within our public finance management system. It exposes the rot that is within the public sector, and the report also exposes our inability to, decisively deal with cases of financial mismanagement. The clear cases of abuse of office, abuse of public resources within that report, and it remains unclear as of today how these cases have been dealt with.
For example, tenders worth 20 million Zimbabwe dollars were awarded to the Manicaland Provincial Works Office without closely following PRA's requirements. 6.6 million Zimbabwe dollars was spent on drilling of 37 non-functional boreholes. In many documented cases across all provinces, donated items were either located to staff, went missing, or simply expired due to non-use.
There was a clear violation of the public procurement regulations. The problem, according to the ministries, they allege or they claim that because of the COVID, because it was an emergency, they had to try to cut corners for them to procure some of the goods. But in the process of doing so, they clearly violated the procurement regulations. The second issue was a failure by the ministry to actually come up with the proper records. Who got what? Like, for instance, the fuel allocation. You hear that the 760 coupons were issued, but there's no recipient. You also get it to a place where people are being given bus fare. There's no one who actually signed for the bus fare, but you hear that millions of dollars were spent without anyone signing for the money. And the argument from the ministry was to say, look, because there was COVID, we were afraid that if they signed, maybe COVID would actually then be transmitted to their staff members.
The Parliamentary Public Accounts Committee called on specific government departments involved in distributing COVID-19 relief funds and humanitarian assistance to clarify issues, but they did not come forward with the details within the agreed time.
We have recommended that ZAC, Zimbabwe Anti-Corruption Commission, needed to come on board and arrest some of the people, to investigate and cause arrest. We've also asked the Zimbabwe Republic Police, and because Parliament has not been sitting, and it will be sitting next week, one of the key issues that we will be doing when we meet in the next week or two is to inquire from the Zimbabwe Corruption Commission and the Zimbabwe Republic Police in terms of what effort they've done in terms of arresting people that actually abused the resources.
As a commission, we found that a number of institutions did not have in place systems to cater for emergency procurement. We found quite a number of situations where the COVID-19 supplies, particularly masks and some other protective equipment, were procured not competitively as expected in the constitution. We did investigate some cases, just that I'm reluctant in terms of mentioning names because the investigations have not yet been concluded and some of the matters are before the courts and they've not yet gone through the whole cycle. But suffice to say that we did prevent certain transactions from happening through our intervention, and where we had reasonable grounds to suspect that corruption had occurred, we did arrest individuals and they were then brought before the courts, but the matters have not yet been concluded to say that we have had convictions, not as yet.
There is currently no law in Zimbabwe offering legal protection to whistleblowers, and citizens have often expressed disappointment in the practice dubbed catch and release, where high-profile cases of public officials accused of corruption are never concluded. The drafting of such laws is one of many responsibilities of elected representatives in Parliament.
And what we have now realized that in Zimbabwe, most of the people that we call business people are tenderpreneurship, people that have actually successfully succeeded in terms of getting government business. And some of them, they don't get the business in the proper manner. There's a lot of corruption, and the Auditor General has actually raised it on several occasions. There's a lot of favoritism in the process, and this is the reason why we fully support the view shared by the CSOs to simply say, let's go for the e-procurement, not only e-procurement, but we also want e-government in major facets of government business. We have seen what Rwanda is doing. Rwanda is a model, and the unfortunate part when it comes to Rwanda, they are practicing what we as a country actually were written papers and positions, and unfortunately we never implemented what we had actually started. But Rwanda took it on board. They actually now a step ahead, and I think we need to go that direction.
An increase in participation by civil society in procurement and transparency issues, upholding the rule of law and fighting corruption will improve good governance. Government must welcome the increasing involvement of civil society as an opportunity to increase transparency and debate on public finance issues.
Regarding the proposals and recommendations for e-procurement system, look, we are in 2023. We are in 2023. Technology is the way to go. Some of the bureaucracies that we have today, they actually enable corruption. They actually enable some loopholes within the procurement system. But I think that e-procurement is the way to go for us to increase efficiencies, for us to minimize opportunities for corruption, and also for increasing transparency.
We are lobbying for government to adopt what is called electronic government procurement, or e-procurement. It's basically using ICTs to run a public procurement system. And the beauty of this is that it reduces or eliminates human contact in the process. As you take your bids from office to office, there is very high risk of bribe-taking behavior for you to win a bid. But e-procurement makes all the information available in the public. You bid online. You go online to get the information about the specs of the bids. Everything is done online from the first stage to the last stage, and limiting human interference in the process.
There are a number of interventions that ZAC can do. We can recommend policy changes in as far as the law is concerned. The Public Procurement and Disposal of Public Assets Act. There are a number of recommendations that we could put in terms of strengthening that particular piece of legislation, where it would then be, it would address how to respond to a situation of emergency, because the emergency that happened with COVID can reoccur, but maybe from a different virus or from a different perspective. Anything is possible.
Since the responsibility of dealing with public emergencies mainly lies with government, it cannot adequately protect or serve its citizens if corruption continues to undermine its response. It is sad to note that amid reports of corruption during the height of COVID-19 pandemic, healthcare professionals were on strike demanding better salaries, better working conditions, and vital personal protective equipment. Such malpractice in public procurement creates a vicious cycle of mismanagement and a deeper crisis.
We are also working on the EGP, where we are trying to remove a lot of human involvement. And in this particular instance, we are looking at the end-to-end EGP, which is electronic government procurement, which will then give bidders and public procuring entities an opportunity to participate using virtual platforms. So these are some of the developments which we are implementing as a regulator.
What the COVID-19 pandemic has taught us is that there are missing links and potential opportunities for transparency, accountability, and integrity for Zimbabwe in the fight against corruption during emergencies. With the ever-increasing threat of floods and other natural disasters as a result of climate change, it is vital that the lessons learned from the COVID-19 pandemic translate into positive change towards the elimination of corruption.